Bonjour tout le monde. Une petite partie en français. Ceux qui parlent uniquement le français, vous trouverez, il y a de la traduction, vous trouverez les appareils en arrière. Donc vous êtes priés d'aller en arrière pour vous procurer des appareils. Donc la présentation sera faite en anglais, mais ceux qui veulent poser des questions en français, Dr Cécile Tremblay prendra vos questions en français. Donc on va la présenter en anglais. Comme j'ai dit, les traducteurs sont derrière, puis il y a une traduction qui est faite. Merci.
Bonjour, good morning everybody. It's a great honor to have with us this morning Dr. Cécile Tremblay. Dr. Tremblay is an infectious disease specialist at the Centre Hospitalier de l'Université de Montréal. She's the director of the Pfizer University de Montréal Chair on HIV Translational Research. Our research program is focused on characterizing determinants of disease progression in HIV-infected individuals, as well as early aging phenotypes. She also works on viral evolution. She has developed several research projects related to COVID-19. She has been at the forefront of medical education for the general population during the pandemic. So please welcome Dr. Cécile Tremblay.
Thank you. Thank you for your kind introduction.
Later.
Okay. Oh, the lights are bright. Thank you for this kind introduction. Merci pour cette belle présentation. So I will do the presentation in English, but please feel free to ask a question in French. So, yeah, so the talk is going to be about preparedness for the next pandemic. Here are my disclosures. I would first like to acknowledge that this meeting is taking place on the unceded territory of the Huron-Wendat Nation. Acknowledging is also learning. And while I was preparing this, I learned, as a conference of infectious disease, we should be interested in that prior to the 16th century, the Huron-Wendat population was approximately 20,000 to 25,000. But when the Europeans arrived, around 1634, 1642, they brought their disease with them, like measles, influenza, smallpox, resulting in a significant decrease in the population to about 9,000. So we're discussing pandemics. Let's think of our past. It seems that in April 2022, the Huron-Wendat nation of Wendake, Quebec, had 4,500 registered members. This is another dark side of colonization. So what I'm going to be discussing are the factors affecting pandemics, the factors affecting the response to pandemics, and the populations that are the most affected. So I could summarize the entire conference with this slide. So the take-home message is that pandemics occur within a certain environment. Climate, politics, social inequities, the state of our health system. So pandemics do not occur on a blank canvas. So the conditions that exist will be influencing everything that's going to happen before. So if we don't start to work right away and every day on changing these determinants, we will not ever have a good preparedness plan. So let's talk about the environment. We know that in the last 100 years, all of the pandemics have been zoonosis, meaning diseases transmitted from animal to man. The bubonic plague, or fleas from rats, the Spanish flu, wild birds, HIV, primates. So it is not surprising that we are going to see more and more zoonosis as we affect our environment. So some of the environmental changes that are important for pandemics are what we do with our forests, with deforestation, where we encourage wild animals to become closer to humans. Actually, we saw during the pandemic, as everybody was locked down, that we were seeing wild animals in center and downtown of big cities. We also see wild animals, dead animals near meat that we're going to sell in the wet market. This still exists and favor transmission of disease. We also, with globalization and our taste, our desire to see the world, an increase in traveling. So the idea that an epidemic that occurs in a certain local geographic area is going to stay there is like, let's forget about that. With this type of interactions across the world, we're going to see more and more of these events occurring and spreading across the globe. So, politics. Politics are important in responses to pandemic. Who's in charge is important. If the people in charge do not believe in science, then the consequences can be devastating. Here is an example in Brazil when Bolsonaro did not believe in science, did not believe in masks, did not believe, or no matter if he believed it or not, he didn't want to implement it because for him it was politically irrelevant. So we saw that the death toll was among the worst at the beginning of the pandemic, and we could see coffins lined up in various rural areas of Brazil, and they happened to have one of the highest death toll in the pandemic. If we look at the various countries and the death per 100,000 population, the United States are among the worst off, along with Italy and UK in terms of proportion. We all remember this infamous press conference where Donald Trump suggested that it would be a good idea to drink Javex to cure COVID, to the dismay of Dr. Birx, who was sitting there and saying, oh my God, to the point that the public health authorities had to issue a warning, do not drink disinfectant, not a good thing. So who's in charge has an impact, and it is important that we all realize that it is important that our leaders believe in science and listen to science. What about social inequities? It seems to be like, oh, well, it exists and we can change that, you know? So, but we need to start and continue working on these if we want to have better preparedness. So Oxfam had this poster that was interesting. Instead of millions of statistics, they were saying it took just 9 months for the fortunes of the top 1,000 billionaires to return to their pre-pandemic heights. And it's going to take decades for the rest of the economies of the world to recover. The increase in wealth of the 10 richest billionaires, just the increase in wealth, not their wealth, the increase in wealth after the pandemic was enough to pay for all potential inequities and vaccinate everybody in the world. In the US, close to 22,000 Latinx or Black people would have been alive if the inequities between white and Black did not exist. 112 million fewer women would have been at risk of losing their income if we didn't have this inequity between men and women. So the social inequities that exist at baseline, it's going to have an exponential impact on the consequences of the pandemic in these various populations. In Canada, this is a study done by the Public Health Agency of Canada. So the mortality linked to COVID, normalized for age per 100,000 people, was directly proportional to the quintile of composition of that ethno-cultural diversity of where people lived. It was also proportional to the income of the neighborhood where the people live, more mortality occurring in poorest neighborhood. it was also correlated with the income of individuals, poorer, lower income, higher mortality. So when we think about that, and we were thinking throughout the pandemic and the message that we were publicizing and spreading was who is at risk, who are the most vulnerable people at risk. So we know for sure the elderly, people having comorbidities, and people having immunosuppression or immunosuppressed. So that was a given, like we spread that message quite a bit. But what about the other factors that will impact somebody, how they're going to manage through a pandemic? So difficulty in reading or understanding, it is known that 48% of the Canadian population can be considered as functionally illiterate, meaning the level 3 they call it, difficulty in understanding a complex text or complex news article. So imagine the difficulty in communicating science that evolve every day, and that one week to another, we have to change the messaging because science has evolved. In a population who has a hard time understanding a simple text. The difficulty of people who already have difficulty accessing healthcare system, so they're going to be less well during a pandemic. The people who do not have access to transportation, who don't have a job that you can easily work from home. So these are all people who are at higher risk of not getting the care that they need during a pandemic. What about the opioid crisis? So there is more talk about the opioid crisis in the large media in the last couple of years, but we could tell, and this is a study from the government of Canada that illustrated the observed and projected deaths from the opioid crisis. And you see that during the pandemic, which are the line at the right, the bars at the right, how the mortality due to opioid increased during the pandemic. And as you can see, the trend is not going down, unfortunately. In 2022, in Canada, there were 4,360 deaths due to the opioid crisis, more concentrated in the western provinces, but present in all provinces. What about people who are experiencing homelessness? How can they access care during a pandemic? How can they access public health messages during a pandemic? We know that they are at higher risk of having a more severe disease or dying from COVID because of the conditions in which they live. Let's say they are in shelters, and the distancing and the mask and all the precautions cannot be easily kept. We know that they don't have access to the information. There were some good initiatives developed during the pandemic, but if you don't address this problem at the start, at baseline, without a pandemic, no matter what kind of disease is going to happen, they're going to be the worst off. Now, people living with HIV, there has been a debate whether they were at higher risk of dying or having a more severe disease. This is a meta-analysis that considered the risk of mortality in HIV-infected individuals according to the CD4 counts. And of course, we see that the major driver of the higher risk of mortality from COVID in HIV-infected individuals is the CD4 count. But it's also the same factors that affect the general population. People living with HIV are aging, have comorbidities, cardiovascular disease, diabetes. So everything has to be taken into consideration. And they have cancers, so they receive other immunosuppressive drugs. So this is also a population that's going to be at higher risk. And if we compare the timeline of the HIV pandemic, which was totally forgotten during the COVID pandemic in the media, we can see that it took about 5 years to identify the virus and develop the test to diagnose it. It took another 5 years to have the first medication that was effective against HIV, but it failed very rapidly because we didn't understand then the principle of combination therapy. So it took more than a decade to arrive to regimens that could be helpful to control the virus. And then it took another decade and more to make sure that everybody who needed it had access to it, and we're still not there for HIV. On the contrary, for COVID, it took 1 month to discover the virus that was causing it. It took 2 days to develop the test to diagnose it, and a month for the WHO to spread the test around the world. It took less than a year to have the vaccine and to have a first drug that was effective against COVID, and then you know the rest. So what was the difference? Well, at the beginning of COVID, there was a panic, and there was a heightened sense of alert, and a lot of money was poured into research, and a lot of collaboration. So it was not one little researcher in his lab doing some research and presenting it in the Congress next year. It was consortium, pharmaceutical, non-profit organization, research institute. They all went together, and we see when there is cooperation how efficacious we can be. So lessons learned. This is a big one. So what about the state of our healthcare system? The pandemic, a pandemic by definition is cross nations, so it's not going to have the same effect in Africa than it has in a developed country. But even in the developed countries, there are differences between healthcare systems. What about our own? Well, we all saw the terrible conditions that our nursing homes were in Canada and in Quebec when the pandemic occurred. And this had dramatic consequences, like no adequate ventilation, several patients per room, vetuste, like old buildings, lack of personnel, lack of protection, PPE, and in Quebec, most of it, no one in charge. They had abolished the position of the chief of this establishment. So the chief of the CHSLD were the CEO of the CIS, the regional organization. So nobody accountable. So when we see this, we can improve this, that's for sure. So there was a project of building les maisons des aînés, which were state-of-the-art, beautiful places for elderly who needs care to occur. There was a project of building 12 of them, like 5 years ago, before the pandemic. Now we're at the most at 4 that have been built. They can house maybe 20 people each. And actually they built one on a preserved land for environment, by the way, just to make things worse. And so now the cost of building these things are 19% higher than it was before, just to say. There were, well, if you don't have good nursing homes, maybe if you have good home care, that could, compensate. And most people would like to have home care when they grow old. So in Quebec, there was 45,600 people on the waiting list to receive home care. And And this is an increase of 10% from the year before. So we're going in the wrong direction. There's more people waiting to get home care than there was before. So we didn't really compensate for the state of our nursing homes. So when I ask you this question, are we ready if there were another viruses that came along, or the same that has a new variant next fall re-emerging that is resistant to our vaccine? Just a pessimistic thought. So are we ready? Are we better off? What do we need to do to be ready? We can write plans. Actually, there were some very well-written plans. After H1N1, Canadian Public Health Agency had a beautiful preparedness plan. Everything that I'm talking about was in there. It was all there. But it sat on a tablet and nobody did anything about it. So let me ask you, have we solved the opioid crisis? Have we made dent into solving the opioid crisis? I would say no. Have we been able to house people facing homelessness? Have we developed more housing capacities for low-income people? This was the talk in last Quebec election campaign about housing. I would say no, we haven't done that. Have we increased the number of nursing homes and the quality of their services? Well, they're changing the law to at least make sure that there's going to be one person who's going to be responsible per establishment. So that's a good thing. But ventilation, repairs, personnel remains to be seen. So I would say no. Have we increased our local capacity to produce PPE? Remember, at the beginning of the pandemics, one of the issues were that we didn't have enough PPE because they were all made in China, and we had this problem with China. So the idea was to become more independent and be able to produce them locally. So there was an effort at that level. They changed the law to facilitate production, imports of material, and we had a few companies that were able to produce them during the pandemic. But this is not a viable strategy for an enterprise, because outside of pandemic, the amount that you need is much lower. So there needs to be a policy that the government subsidize these people so that they can maintain the capacity to produce these PPEs, so that we need them, that we have them when we need them. The capacity to produce our own vaccine, well, there was a good development in that regard, because now we have learned that Moderna is establishing themselves in Montreal, and so we're going to have facilities, and there are a few other facilities that are institution-based, university-based, that are going to be able to produce vaccines. So that's a good news. So I'm going to give them a yes, okay, for that. Have we been able to recruit more nurses and healthcare staff? Have we increased our capacity for acute or subacute care? So I found that interesting article that was on the web from the Canadian Nurses Association in 2007. And they were projecting that in 2022, there would be a shortage of, I don't remember the number, but 70,000 nurses, I think that was the number, but a big shortage. That was foreseen, we knew it, and that was without a pandemic, without the increased need during a pandemic. So what was done since 2007 to help train new nurses, hire new nurses in our healthcare institutions? Well, if we don't know how to do that, some people have thought about it. This is a paper published in Facets, and they list all the things that need to be done to train, attract, and retenir nurses in our healthcare system. And so the recipe is there. It's not that we don't know what to do. A survey showed that what is wrong with retaining nurses is that the workload is too high, the anxiety is too high, the communication is not appropriate, the shifts, the way the time is organized is not appropriate, the salary is not appropriate. So we know what are the issues. So we just need to do something about it and not wait for the next pandemic. So some have advocated the role of the private sector. Oh, then we should get nurses from the private sectors. But these are communicating vessels. We just train a certain number of nurses every year. So if they all go to the private sector, they're not going to be in the public sector where we need them the most. So for me, it's not only a false solution, but it is detrimental to the future of our public healthcare system. So have we been able to recruit more nurses and healthcare staff? No. Have we increased our capacity for acute and subacute care? Just going to give you an example of that. Like I work at the CHUM, we're the brand new, beautiful, large hospital in Montreal. And so we have a lot of beds. And every day, 100 of these beds are occupied by patients that we call NSA. No need for acute care anymore. We have cured them, we have helped them, but they're not in good shape enough to go back home. So we would need these transitional rehabilitation for a month or something in order to get them in better shape. They refuse to do that. So then we see the emergencies are overwhelmed, and then we have these 100 beds that people could come from the emergency and move into these beds, and that would take care of the emergency room crisis. But it is short-term vision, and they only think of improvement in each step. They don't see the entire picture. So no, we haven't increased our capacity for acute and subacute care. Have we been able to increase our public health capacity in terms of staff, in terms of monitoring tools? Well, we've done some progress in that. Because of the pandemic, there was a realization that public health had been underfunded for decades, and there was a lack of personnel. So there needed to be a lot of contact tracing and phone calls and tons of work to do during the pandemic. So they hired more personnel during the pandemic. But is this going to be permanent? Do we have any proof that this is going to stay the same? We don't to this time. What about monitoring tools? Well, just in Quebec, to tell you the truth, the reporting of MADO, of obligatory infectious disease report, I don't remember the term in English, was done through fax, like in the antiquity. They had fax, like Pac-Man or fax. So how do you want to have the numbers that you need to manage a pandemic when your tools are so archaic? So good people worked very hard and developed rapidly the tools that we needed to have some good statistical analysis during the pandemic, thanks to people at INSPQ. But we were starting from scratch. So when I'm saying that what we need to do is in between pandemics if we want to be prepared. So we discovered that we could monitor water, the used water, to see the prevalence of the virus circulation. But this was happening elsewhere for several years. So we developed it, and thank God we have this new tool. But, it's not perfect. So because we don't know for certain that the resources for public health are going to be maintained, I'm going to give them a no. So are we protecting our water air, trees, and soil? I will let you answer that question. Who says yes? Who says no? Yeah, I would say you're right. So preparing well involves a lot of things to think about and to look at, and especially the psychosocial impact of pandemics. It starts at the individual, and with everything else in social sciences, you know, it goes wider and wider to society in general. But have we thought of the impact of having a person who died in our family on the individual? We all are kind of familiar with that. But when we are facing numerous deaths, let's say in the community, what is the impact of that on that community? How will they survive that? That's an important impact. Have we thought of the impact of just the disease itself on the individual? Its incapacity to work, but also the long-term sequela of the disease and how it's going to impact our healthcare system. Have we thought on how to prepare to procure the basic needs of people who need it? Meals on Wheels, for example, access to medication for people who cannot go to the pharmacy, hygiene, clothes, transportation. Do we have a plan for that? What about sorry, it is written very small. I'm going to not fall in. We think about psychological impact. Okay, so we all saw during the pandemic that there was an anxiety level very high among almost everybody. There was also depression, like more than just anxiety. I saw in my patient population probably about 30% of them who told me that they felt depressed. Maybe not to the level of a DSM-5 diagnosis of depression, but really, really depressed because of isolation mostly. And it gives them time to think of all the things that are not going well. So have we thought of the resources that we would need in any pandemic to give mental health services to the population? Mental health is already an underserved services. So we need to think about that. Destructuration of society. So we don't do things the way we were doing them before. We work from home, we don't see each other, it affects transport, it affects downtowns are deserted. This has an impact as well. An economic impact, of course, some people are jobless. And actually I would say that in Canada, we did quite a good job in general to compensate for that with the federal help. However, there were certain sectors of the economy that were terribly affected, such as the culture. They were one of the most impacted sectors. So we would need to have a plan for that for the next pandemic. In communications, I talked about it before. So how do we counteract misinformation? How do we counteract with what's happening on social media? So how do you deal with expert opinions that contradicts themselves to make sure that the message is coherent and that the people can follow? So we need to have a good communication plans. So what did we learn from this lack of pandemic? It is important not just to see how healthcare or public health people or government, what they learned, but what has the public learned from the pandemic? Are the vaccines a good thing or a bad thing? Are masks a good thing or a bad thing? Is hygiene useful or not useful? Well, you would be surprised on what the lessons people have learned. So we all remember this unsavory moment when the trucker invaded Ottawa, and unfortunately, a few weeks later, the measures started to soften because the pandemic was starting to be less, COVID cases were dropping. So a lot of people made the equation, oh yes, we were right, we don't need masks, we don't need vaccine, this is all. So they didn't learn the right lesson necessarily. And if we look at the, this is a study done by INSPQ to see the vaccination attitude among Quebecois adults. And the good thing is there is still a majority of the population, almost 80%, 75 to 80%, who really think that vaccination is a good thing. And there is this proportion that is always there, about 20%, 15%, who really don't believe too much in vaccination, but this is nuance also. But we see that in the last year, there has been a decrease in the vaccination of children, their basic vaccination against measles and everything. So some people had a negative, the pandemic left a negative impression for them on vaccination. So this is work that we need to continue to do. So what I was trying to say throughout this talk is that preparing for a pandemic is an everyday task. It's working, continue to work what we're doing, what you're doing, to counteract these social inequities, to work on improving our climate, to make sure that we have the right politicians at the right place at the right time, and to be mindful of the consequences of what we're going to need to do in the next pandemic. Some people have taken, because of the consequences of the confinement, that some of them were very bad in terms of consequences. For example, school children, for example, depression, for example, when we were forbidding elderly people to see their family, they say, oh, that's not a good measure. Well, let's remember that if we had a pandemic with an Ebola virus-like, with a mortality rate of 70%, we would need to confine. But we would know how to do it better if we learned the lessons from what happened. We would know how to put in place the mechanism that will diminish the harm that can be done through that. So solidarity is about helping everyone to bear the burden of life and make it easier. That's a quote from Henri Frédéric Amiel. I think solidarity is the best way to prepare for a pandemic. Thank you. S'il y a des questions en français ou en anglais, gênez-vous pas. Ou des commentaires. Oui. Yes.
Merci beaucoup pour la belle présentation engagée. I'll ask my question in English. If I remember correctly, the single only check mark that you gave was for the vaccine preparedness. And you spoke about Moderna. Everybody loves Moderna. They're here as sponsors. But Montreal has learned over the years that, you know, foreign companies come and they go. So could you simply speak a little bit more in detail about the public efforts in Canada to be ready to make vaccines?
Yes, actually, you're totally right. Actually, there used to be like 7 big pharmas who have siège social in Canada, in Quebec, and they all left in the early 20s. because I think there was not an incentive enough and a preoccupation enough for the governments to think it was important to have this basic infrastructure. So the Canadian government did also, they gave a lot of money to develop other vaccine facilities. For example, there is one being built in Montreal, there is one in Saskatoon, and so there are other facilities that are really public, you know, and they have the potential of developing the vaccine, making the first quantities, maybe not expanding it to high-level production, but at least the first steps. And also, there has to be efforts from the government to support those little private biotech who are starting trying to develop new products. And I think this was also done partially, and we can improve on that.
Merci, Cécile. Comme tu le sais, il y a eu beaucoup de désinformation durant la COVID. C'est quoi le rôle que tu penses que les chercheurs qu'on a à essayer de combattre cette désinformation-là? Comment tu penses qu'on devrait faire pour enseigner un peu la science comme de base pour que les gens comprennent que oui, ça change vite, mais que les informations qu'on leur donne, c'est ce qu'on sait présentement, puis comme offrir ce de base-là pour la population, pour qu'ils comprennent un peu qu'est-ce qui se passe quand il y a un nouveau virus, puis des choses comme ça? Mm-hmm. Tu peux répondre en anglais.
Okay, so that's a very important question. So how, as a researcher, can we counteract misinformation when science is changing so rapidly? So that was the challenge during the pandemic. I was often on the media, and I was trying to explain it as simply as possible, always acknowledging what we don't know, because it's important that people know that science doesn't have all the answers, but the answers are going to come from science eventually. One thing I would say, first of all, researchers should get involved in disseminating knowledge. And not only during the pandemic, when you're asked to participate in high school fairs, you know, to attract young people in science, when all of this is helpful to heighten the level of knowledge of the society in general about science. But one thing is to get engaged. When you're asked to do an interview, make sure that you do the interview in your field of expertise. Because sometimes we saw people, you know, who wanted to do well, no problem, but they were completely outside of their field, and then this doesn't help sometimes to have a unified message in terms of the science that we want to produce. But the first thing is to get involved, and the more science there is out there. We saw during the pandemic that the level of knowledge of the Canadian population about science increased from this to this. People were discussing antibodies, they were discussing all kinds of concepts that they would never have thought before. So it works when you do it well. The other thing is young people have to get involved in the social media sphere to counter, because this is where the misinformation was the most during the pandemic, because the streamed media had a pretty good tone. But it's young people who are going to be able to do that.
But that takes a lot of time.
Yes, it takes time, but it's important.
I know.
It's a part of our role as teachers.
Yeah, then maybe university needs to see it too as a part of our role.
Mm-hmm. Thank you. Michel?
Merci Cécile, vraiment très intéressant présentation. Juste un court commentaire. So a short comment that is about, you know, the points you checked, yes or no. So in actual fact, the only place where there's about a clear yes is again on biomedical solutions. Okay, so basically, or procurement of tools, of biomedical tools, of vaccines, you know, better capacity for protection, for manufacturing a protection material. But if you go for all the social aspects of response to pandemic, that's a disaster, basically. Okay? So it's just a comment like that. Again, we put all our eggs in the very technological aspects of things and very much less on the more social aspects. That's probably the most important for people. That's just a comment.
Thank you. That's a bit the point that I wanted to convey. And it's not because I don't recognize all the work that was done with all the people in these various communities, and things have been done to help communities and to help patients on a social level. But the overall government involvement into advancing these themes has been very weak. Je sais pas, I think you?
Thank you so much for your presentation. I was just wondering if you could speak to the role of something like greater and meaningful involvement of people living with HIV and Indigenous people in pandemic preparedness for the future.
The role of people living with HIV?
Yeah, and Indigenous folks and
Indigenous people.
Yeah.
Well, I think that, as I was mentioning at the end, one of the worst disaster of the confinements it's the isolation of people. Isolation that leads not only to mental health problems, but also to lack of, for example, lack of PrEP delivery, lack of HIV testing, lack of access to medication. So communities can really help with ensuring that people are not left behind, that they're not left alone. And we saw that with, for example, with elderly people. There were some groups who were systematically phoning everybody every day to make sure they were okay, were their needs or anything. So there is a big, big role for community support and inventing tools to be able to do some outreach in these situations. So I think it's major. Yeah.
Sorry, thank you. Thank you very much, Dr. Tremblay. For the sake of time, please ask your question after. So we would like to present you this gift. Thank you very much. And
Thank you very much.
for this inspiring talk.
Merci. Merci.